All right, good afternoon, everyone. Appreciate you jumping on the Social Security webinar for tonight. I appreciate everyone being timely. I'm Nate Brieby with Klaas Financial. We have Eric Schmitz on the line as well, and Megan from Social Security. We are going to be going over our Social Security and Medicare planning webinar tonight. We'll go run about an hour. Please feel free to type in the Q&A box any questions along the way. And if we have time at the end, we will also open it for live questions. You should all be joining in view-only mode so we cannot see you or hear you. So once again, if you have questions, please type in the Q&A box there with your question. So I guess, like I said, Nate with Klaas and Eric, I'll turn it over to you to give kind of a background of Klaas and how kind of Megan, obviously with Social Security, fits into our presentation tonight.
Yeah, absolutely. Yep. Hi, everyone. Again, my name is Eric Schmitz. I'm one of the financial planners here at Klaas, and I want to take just some quick time here to talk a little bit about Klaas, who we are for any clients that are not familiar with us, or for any of our current clients, just a review of how big we are and how much we've grown over the 50 years that we have been in business. So this is our 50th anniversary, and it's a big deal for our firm. We take a lot of pride in serving the areas that we have during this time frame here. As you can see, we work with over 1,000 households. We work in over 32 states, and we have about 25 employees across two physical locations. One of them up here in Madison, Wisconsin, which is where I'm at, and then Nate is down in our Rockford, Illinois office. So a lot of what today is going to be is working with Megan, who is fantastic. She is super, super smart to help us navigate and learn more about the Social Security world. There's always a lot of buzz about this, but I think Megan can do a really good job of sharing with us really, really good information, which often is what Nate and I deal with every day with clients. Social Security is a big topic. It's super important. So I think being educated on it and having someone like Megan is going to set up that conversation nicely.
Yep.
So, Nate, do you got anything else before we hand the mic over to Megan?
No, just quickly that, this is obviously a huge part in a lot of our retirees' retirement plans is Social Security. So, as your financial planner, we try to address, all 6 areas of your financial life. And, this is a huge topic, like I said, and Eric and I definitely are well versed in Social Security, but boy, we learn something every time from Megan. So we love having her on and excited, yeah, see your presentation today. So we'll turn it over to you, Megan, to pull up your slides and start going through the information. I guess one last thing, this will be recorded as you've seen, so this will be posted on our website in the coming weeks as well. So don't be worried about scribbling down every little last piece of information too. So
Right.
All right, yes, thanks so much for joining me. I'm a public affairs specialist for Social Security. I'm based in Peru, Illinois, but I cover 17 offices in northern and north central Illinois. And then I also back up my colleague who covers Madison and southeastern Wisconsin. I've been with the agency for 21 years and just had my 21st year, so I always have to remember that. So today we're going to go through an overview of benefits and programs, a little bit on Medicare, and we'll go through questions as mentioned at the end. With Social Security, we're going to start right off the bat with retirement and just the basics as for how you qualify for a retirement benefit. When we're working and we're paying those FICA taxes that we pay into Social Security's trust funds, we're earning credits, or sometimes people call them quarters of coverage. To get a retirement benefit, you just need to get 40 total credits in your lifetime. A lot of us are going to have that within 10 years of work. And that's because you can earn up to 4 credits a year. And this year, each $1,890 gives you 1 credit. So you don't have to make a lot of money paying into Social Security to get those 40 credits. Once you have the 40, you have enough for retirement. So I think I was around 26 back when we used to send those paper statements every year. And I got my paper statement and it showed that I had all my 40 credits. When you have the 40, you'll know because it's going to give you a retirement estimate, and we don't provide a retirement estimate until you have the 40 credits. If you have less, it'll give you the number of credits that we have listed for you. Now, of course, when I got that statement when I was 26, the amount wasn't looking too great for what I would get when I was retired because I wasn't working very long at that point, especially not full time. And the way we calculate your retirement benefit is we're going to take your wages and we adjust them for inflation, or we adjust them for wage levels over time. Then we find the monthly average of your 35 highest years of earnings, and we apply a formula to that. So the average index monthly earnings gets a formula applied to it. That's how we get to your monthly benefit rate, your full retirement rate, and then anything reduced from it for taking it early. So full retirement age is when we consider you to get your unreduced benefit. So you can see from this slide, this individual's full retirement age is 67. That's going to be a pretty common full retirement age, and we'll talk about that a little more in a moment. But you can take your retirement as early as 62. So anytime you take it early, it's going to be reduced and it stays reduced. It has that age-related reduction, is a permanent reduction onto your Social Security once you take it early. So you can see in this example, the person, if they take it at 62, they'd be due $1,400 a month. At 67, they're going to be at $2,000 a month. So that's a big jump between early retirement and full retirement. But every single month the person waits, it's in between, it's going to increase. So it's not like you have to wait for these benchmarks. You can start at 63 in 2 months and you're going to get whatever that rate is. Every single month it's crawling up until full retirement age. Then what actually happens at full retirement age, should you decide to wait longer, is that you're going to earn what we call delayed retirement credits. You earn those between 67 and age 70. Those average about 8% per year. So you can see in the example, if the person waited between 62 and 70, their monthly benefit goes up over $1,000 a month. So that's quite a big jump in what a person would receive monthly. However, the person taking it, if they take it at 62, they did get 8 years of benefit checks. So they collected quite a bit of money up front. A lot of times it might be 15 to 20 years till it was no longer advantageous for that person to have taken the benefit early. So some things that people might consider when making a decision as to filing early or not would be the longevity, expectations in their family. Does everyone live to be 100, or is that not always the case? At Social Security, all we can do is tell you that money amount. We're not going to go through all those other factors with you that a financial planner might, but we're going to give you the facts as to what your money is, and then you're going to have to consider all those outside factors, your other income, your lifestyle plans for retirement, all those sorts of things are going to be what you're going to take in and use to make the final decision. So as I mentioned, this is where we have most people coming in at 67 for a full retirement age now. That's because everyone born 1960 or later, that's going to be your full retirement age. But we still are seeing our retirees that are at 66 and 8 months, 66 and 10 months. Those are still ages coming in for full retirement age. But just know if you're born 1960 or later, it's 67. So that's my full retirement age. Should I take it at 62, I'd be looking at a 30% reduction from my full benefit rate at full retirement age. One big consideration is if you are deciding if you're still working when you file for retirement benefit, and if you're under your full retirement age, because when you are under your full retirement age, you are going to have work restrictions. So there's a limit this year of $24,480 if you're under the calendar year you turn your full retirement age. So for example, my birthday's in July, that full retirement age is 67. The January that I turn 67 would be the calendar year that I'm turning my full retirement age. So if I was under that this year and a bit over 62, my full retirement or my earnings limit would be $24,480. After that, we hold $1 for every 2. And the way this works is we're going to ask you for an estimate of your earnings if you're still working up front when you file your application. If you are going to be over that earnings limit, we are going to hold checks in what we call work suspense. So we're going to hold those up front before we pay you any money. So let's say, to make this example easy, that you're making exactly $20,000 over the earnings limit. So you're making $44,480 this year. And you contacted us. You're just turning 62 this month, in the month of March, and you say, well, I want to go ahead and start my checks with April. And we're going to say, okay, are you still working? Yes, you're working. You're making that 44,480. So we're going to say, we're going to look at $1 for every 2 over that limit. So $20,000 over the limit, we're counting $10,000 of that. If your monthly benefit checks are $2,000 a month, we're going to hold 5 checks in work suspense. So in your situation, you turn 62 this month. The first full month you're eligible for a check is April. We're holding 5 checks. We're going to hold April, May, June, July, and August in work suspense. So even though you're starting at the April of 2026 rate, you're not going to get any of those checks. So September, paid in October, would be the first month you'd receive anything for a check, because we've held those 5 months. Then all Social Security checks run a month behind. So it's up to you. You might decide in that situation, well, maybe I'm not ready to go ahead and take it at that April rate because I don't want to have all those checks held. I'm going to just leave it, not file yet, and keep growing. But if you do go ahead and take it, you're going to start at that April 2026 rate. What will happen, though, is when you get to your full retirement age, we're going to recalculate your benefit because we held those checks in work suspense. So almost like you took it the 5 months later than you did, and give you credit for the work suspense months. That's why it's always better to give us your best accurate work limit when you can and let us hold your checks in advance. Because say that you hadn't told us about your work and you got overpaid the following year, you owe us all that money back and you don't get the benefit of having those checks held and get your benefit recalculated. So in that example, that's a situation where you're working throughout the calendar year. But what if, you're contacting us and you're going to stop work soon? So you're going to say, I'm thinking about retiring. You're already 62. Once this weather gets nicer in Illinois or Wisconsin, I want to start enjoying the summer. I want to retire. So I'm going to quit working at the end of May, and I'm going to work full time up until then. So I want to start my checks in June. So it will not matter what you made between January and May if you're not starting your checks till June, because there's another test we can use when you file, the year you file, and I forgot to put the monthly limits down, but it's just the yearly divided by 12. So this year it's $2,040. So if you are going to be under $2,040 a month from June and every single month for the rest of the year, which would, if you were completely retired, would be easy for you to do, you can make $80,000 between January and May and still receive all your Social Security checks. Then when the year you turn your full retirement age, you have a much higher earnings limit. And like I said, so my example, I turned 67 in the month of July. It's for full retirement. It's the first day of the month. So if I was turning 67 this year, I could start my checks in January, make $65,160 between January and June. As soon as I hit full retirement age, the first day of that month, there's no earnings limit. If I should go over that 65,160, they'd only hold $1 for every 3. So that's quite a bit higher of an amount. You could consider maybe drawing with January of your full retirement age. Or if you wait and all the way till your full retirement age or beyond, you can make as much as you want. There's no earnings limit at that point. So full retirement age is where you get your unreduced benefit. If you wait to draw until that point, it's also where you no longer have your earnings limit.
Hey, Megan, back on the previous slide on
Sure.
with their benefits, people may be wondering how they find their own benefit. That calculator, I guess one back, please. That's not to their actual earnings record, right? They would have to go to get their own account and
Right.
all
This is just to help you get your full retirement age.
that. Oh,
So
okay.
what and when and doing quick calculations of reductions. So we're going to talk about toward the end how you find your own
Okay.
benefit
Thank you.
estimate, but we'll definitely cover that because that is a big question. Everybody
Sure.
needs to know what their benefit's going to be.
Perfect. Thank you.
So whenever you file for a benefit, whether you file online or you do it via phone appointment, we're always going to ask questions to find out if there's anyone else due benefits on your record. Also, if you might be due benefits on anyone else's record. So the first set of questions is about children. If you have any children that are under 18, still a full-time student through grade 12 in high school. So we don't pay the transition program or beyond age 19, but it's pretty common that children turn 18 their senior year of high school. We can keep paying till the end of the school year. Now, that last tab is something to really think about. 18 or older and having a disability that began prior to age 22. So the key is just when the disability began, not how old the adult child is when you file. You could have an adult child that's now 35, 40 years old by the time you file for your retirement benefit. If they've had that disabling condition since before age 22, they're not currently married, they're not working substantially, they can potentially get a benefit off your record, is what we call a disabled adult child. So what you always want to do is list them down, and then whoever gets your application will develop for that potential benefit for them. As long as you list children down, they're going to be protected by your application. Now, these rules are the same for children, whether the parent is applying for disability, retirement, or a parent passes away. Then the first category of spousal benefits we're talking about is a couple that's currently married to each other. So whenever our next set of questions is going to be, are you currently married? So if you are currently married, in order for either of you to collect off the benefit of one another, you both have to be 62. The only exception to that is a younger spouse who has a child in care under 16 of the person, of the worker who's filing or who has a disability. Another thing to keep in mind when we're talking about these benefits is that children, spouses, we'll talk about divorced spouses, survivors, all of those categories have the same earnings limit that the retiree has. So that's something to keep in mind as well when considering whether anyone else can get a benefit off the record. So what we're going to do is, let's say it is a situation where both you and your spouse are either filing or collecting a benefit. We are going to always look at the person's own earnings record first. So you cannot take a benefit off a spouse only. You have to look at your own record first, unless you don't have 40 credits. So we're going to look at 100% of your own benefit. We're going to look at 50% of your spouse's benefit. And this is your full retirement age rate. So if you're taking it early, we're still looking at the full retirement age rate. If 100% of your own is more than 50% of your spouse's, there's no spousal benefit payable for you. Same thing for your spouse. If 100% of their own is more than 50% of yours, there's no spousal benefit payable. But let's say I'm filing, my spouse is already on benefits. 100% of my benefit is $2,000. 100% of theirs is $3,000. Well, half of that's $1,500. I'm not receiving anything off of them. They're not receiving anything off of me. But if 100% of mine is $2,000, and this as well, I'm going to go 100% of mine is $1,000. 100% of theirs is $3,000. I can get up to $1,000 off my own, up to $500 off of their record to get to the full $1,500. Now, anytime a benefit is taken early, that's going to have the age-related reduction applied to it as well. So again, the key with spouses benefits is nothing is payable till the worker is collecting a benefit. That's the key thing for a current spouse. Divorced spouses are different. So there are some similarities and there's some differences. To receive off a former spouse that's living, you cannot be currently remarried. Your marriage has to have lasted at least 10 years to the person. You have to be at least age 62 or older. Here's where, and also we're going to consider your own benefit before we look at anything off the spouse. But here's where it's different for divorced spouses. The ex-spouse does not have to be receiving the benefit yet. They just have to be eligible to receive it, meaning they're at least age 62 or they're collecting their retirement or disability. So that's the big difference with divorced spouses benefits. It can be paid independently without that worker collecting yet. And the final category of money benefits we're going to talk about, survivors benefits. So the rules for the children being entitled are the same: under 18, still in high school through 19, disabled before age 22. But you can see for surviving spouses and for surviving divorced spouses, the rules are a little different for age. These benefits can be given as early as age 60 or as early as age 50 if you have a disability, or again, any age of caring for a child of the worker who is under 16 or has a disability. The other big thing with survivors benefits, you can remarry after age 60 and still keep your eligibility to survivors benefits. Just the big key is that the remarriage happens after age 60. And yet another difference is the amount you can receive as a survivor. So survivors receive a higher percentage than spouses off somebody who's living or former spouses off someone who's living. You can get 71.5% at age 60. This will continue to increase up until your own full retirement age, or it could be up to 100% of that worker who's passed away's benefit. And just to recap of the differences between the two. So when you're filing off a spouse or former spouse who's living, the earliest is going to be age 62, unless you have that child in care. It's 50% or less that you would be due, whereas survivors as early as 60 or 50 if disabled, 71.5 to 100%. So you might not be due a benefit off of your current or former spouse, but if they pass away, then you want to recontact us to see if you're now due a benefit as a survivor with that higher percentage. Because if they were the higher earner overall, then we're likely going to need to take a survivor's application to move you to the higher benefit. The other thing with survivors is we talked about the rule where everyone has to file off their own benefit first before looking off a spouse or former spouse. That only applies to someone who's living. That policy is something called deemed filing. It does not apply to survivors benefits. So you actually have some strategies you can use with survivors benefits that you can't use off of somebody who's living. So you could take your survivor's benefits at age 60. You can switch to your own as early as age 62 if yours is higher then, but you don't have to switch right away. You can keep drawing that survivors and let your own keep going all the way till 70 and earn those delayed retirement credits. Or another thing you might do is take your retirement at 62, let your survivors keep growing until your full retirement age. Those are options that you have when you're considering survivors benefits and when to file.
And Megan, just to reiterate that, survivors benefits do not have delayed retirement credits. I know you said that, but just so everyone gets that, that's a huge thing. You
Yes,
can't,
yes.
there's no benefit to let them defer
Right. You
past
don't want
full
to wait
retirement.
past full retirement age to draw. So you don't want to wait past 70 to draw off your own, and you don't want to wait past full retirement age to draw as a survivor, because that's going to have zero benefit to you as far as growth.
Yep.
Okay, so switching gears to Medicare. Now, just right off the top of the bat to say that Social Security, the only part of Medicare we do is enrollment in Part A and Part B. So I can cover the basics of all these, but the part that we do is pretty minimal in Medicare, but we are in charge of getting you signed up. So with Medicare for, I think since the 60s sometime, don't quote me on the exact year, we've had Medicare's Part A, your hospital insurance. That is only covers the actual hospital when you are hospitalized overnight or more. It does not cover the doctors you see at the hospital or anything else. It's just inpatient coverage. If you have 40 credits from yourself or a spouse or former spouse, you do not pay anything monthly for Part A. Then Medicare Part B, that's your doctor's coverage, like when you're going to doctor's visits, outpatient procedures, certain medical supplies. This has a base premium this year of $202.90 a month. Some people do pay more. Then, around the time I was hired, we were adding Medicare prescription drugs or Part D, and then people could add supplements. So anything above the letter D is considered a supplement or a Medigap policy. Then increasingly popular are Medicare Advantage plans, also known as Part C. So in this situation, you still enroll with Social Security for Medicare A and B, but the difference is once you're on a Medicare Advantage plan, instead of going to Medicare with all your billing questions or coverage questions, you go through your Medicare Advantage plan. Some people like Medicare Advantage plans because they usually have the Part D figured out for you right alongside it, and they might have better vision, hearing, dental that are not covered well by traditional Medicare and can lead to lower out-of-pocket costs for some as well.
Megan, a couple of silly questions on that.
Sure.
Obviously, so Part A is the same 10 credits, right, to be eligible for or 40 credits, I'm
40
sorry.
credits.
Yeah,
Yep.
40
40
credits. Yeah.
credits. Mhm.
So what about if a spouse stays home and does not have 40 credits, but their spouse does as a
Sure.
married
So
couple?
they can get Medicare off of their spouse if their spouse is 62 or older, even if the spouse has not filed for their benefit yet, but the spouse has to be at least 62. But then they can get it off of a spouse in that situation that has the 40 credits.
Even if that spouse who has 40 credits is not yet 60, or that spouse has to be 65?
They have to be 62.
Oh, okay.
62 or older, and then you can get the Medicare off of them. Um, and then if not 62 yet, you have to buy in to the Part A, which costs, let's see, this year the base premium is $565 a month.
Mm.
So that can be tricky for people to afford. But a lot of times in that situation, it's common that maybe the spouse is working and covering them too. It just kind of
Right.
depends, which we'll talk about a little bit. Um, but yeah, 62 or older, the spouse needs to be if you don't have your own 40 credits for that free Part A.
Yeah.
So, of course, 65 is going to be the thing we're talking about today as far as when you can go on to Medicare. But just to let you know, some other opportunities for individuals to get onto Medicare. Individuals who are found disabled and on Social Security disability, they get Medicare after 24 months. Unless found disabled with ALS, there is no longer a 24-month waiting period for Medicare and ALS. If you're found disabled with ALS, your Medicare starts right away. And then we have a provision, it's called end-stage renal disease that corresponds with kidney failure. And that's a specific type of Medicare that people will usually be informed about through their doctor or dialysis center. And that can be done independently without a disability. People can even have it while still employed, but that's a very specific type of coverage. And like I said, the doctors will kind of clue you in if that's a situation you're in. Now, as far as age 65, the first opportunity to get into Medicare is your initial enrollment period. That's the 3 months before you turn 65, the month of, and the 3 months after. So again, I have a July birthday, so it would be April, May, June, July, August, September, October for me. But if you want it to start the first day of the month in which you're 65, you have to do it the 3 months before your 65th birthday. If you wait till the month of your birthday or the 3 months after, it's going to begin the month after sign up. So if I'm 65 and I sign up in July, it's going to start in August. But as long as I signed up in April, May, or June, it's going to start the first day of the month of July. Now, that is your first opportunity. Not everyone is going to need to apply for their Medicare within that initial enrollment period. Now, if you are already receiving a monthly Social Security check from your own or another person's earnings record, though, you are automatically going to be enrolled in both A and B, and you have to have the Part A if you are receiving a Social Security check by law. But you could refuse the Part B or wait to enroll completely and get in under a special enrollment period. We're going to jump down to that third one first. So the special enrollment period is if you are covered under group health insurance, and the key is through your employer. So it is not marketplace, it is not the VA, it is not a self-employment insurance, it's not a retiree insurance. There's two things that need to be met: that you are actively employed and that you're covered under group health insurance based on active employment. So both have to be met. Now, it can be your own employment or your spouse you're currently married to's employment. But again, active employment and the coverage is going through there. So I have employer group health coverage through Blue Cross Blue Shield. If I was still working and had my coverage, no need for me to take the Medicare at age 65. But if I'm already retired, I'm going to have a retiree health insurance. I need to get into Medicare at age 65 because I wouldn't be meeting the actively employed part of it anymore. Now, in that situation, we're going to talk about when you can get in. But first, I want to talk about that middle one, the general enrollment period. The only time this applies is when you do not take the coverage at age 65 and you do not have that active insurance based on current employment. So either, maybe you didn't understand and you had the retiree insurance and you missed your enrollment period, or you're somebody that says, I don't want to pay $202.90 a month, and then you just refuse to take, the Medicare, whatever situation. If you don't meet the criteria for special enrollment period and you need the coverage down the road, the only time a year you can get into it is the January through March of every year. The coverage begins the month after you sign up. And there is a 10% penalty onto the monthly premium for every year you did not take the coverage. It is going to feel like everyone in the world has found out you're turning 65, and you're going to get all kinds of stuff in the mail. And a lot of it is going to talk about those penalties and try to kind of scare you about Medicare. So just do your research. If you're still working or your spouse is still working, all you have to do is talk to your benefit specialist at work, confirm whether your coverage is continuing with the employment or if there's any reason for Medicare, and then you'll know whether or not you filed for that special enrollment period. If you're going to have the special enrollment period, ignore all the mail about those penalties. That only comes with the general enrollment period. Now, with your special enrollment period, there is a little bit of a nuance as to when your coverage can start. If you sign up in the month that your last full month you're employed or the first full month after you stop work, you could choose to retroactively go back to the first day of the month. So let's say you stopped working last month, you're just getting your paperwork in today to Social Security, but you want it to go back to March 1st, that's fine because you just stopped working last month. Or you could say any of the following 3 months. I want it April, May, or June to start. But if there's 7 more months to this, it's an 8-month total period. If you wait for any of the other 7 remaining months, the coverage is going to begin the month after you sign up. You don't get to pick when it starts. So the only time you get to pick is whether you're still working or the first month after you stop working. So that's just something to be aware of with that special enrollment period. Now, filing for Medicare only is pretty easy. You can do that online. So say you're somebody that's waiting till 67 or 70, but you're no longer covered under group health insurance, you can do Medicare only, and you can get that done online. Let's say you're ready for your special enrollment period. You have your Part A, but you need to add the Part B. Those are just a couple of forms we need. You can get those online as well, and you can submit them online or by mail, fax, or dropping them off in the drop box at your local office. The two forms for that are the CMS 40B that says you're ready for your Medicare to start, and the CMS L564, where you or your spouse's employer verifies there's both that employment and the group health coverage through the employment to get you that special enrollment period. And then everything else Medicare related, we're going to direct you to medicare.gov. Always make sure you're going to .gov when you go to any of our sites. So SSA.gov, Medicare.gov, IRS.gov. That GOV is really important to make sure you don't get to like a scam sort of site. But Medicare.gov has all the doctors coverage, all the things that you might want to look up and explore there. So I did mention the base premium is $202.90 a month for Part B, but that some people pay more. Here's where you can find out if you'll be paying more. The additional charge is called IRMA for short, income related monthly adjustment. What I really want to emphasize about this is you will get a letter in the mail if this situation applies to you. It's a very thorough letter. It explains a lot of detail as to what you can do if there's something you need to adjust with it. But if you do not act on your letter, we can't protect you back to any time before you act on it. So you might be subject to these extra charges, or you might qualify for what's called a life-changing event. So the letter you get will walk you through if you have a life-changing event. What we're doing with this is we're defaulting to using 2 years prior modified adjusted gross income. So in 2026, we're using 2024. So let's say you were still working in 2024, but you stopped working since then, and your modified adjusted gross income is going way down because of work stoppage. That is one of the life-changing events you'll see listed in your letter. It'll talk about the form you get in SSA 44. As soon as you submit that to the office, even if it takes the office a little time to process it, it is stamped with the date we receive it and will protect you with that date to make adjustments. But if you wait 4 months to send the form in, you're going to be due that additional charge for the months prior to when you got us that form. So that's why you want to open that letter and look through it carefully. So there are life-changing events like that where you can adjust it. There's also one-time events that might just cause it to be higher for a year. My dad and his sister sold the family farmland in 2024. So guess what? I got a text. Why is my Social Security check so low this month? Well, that's because your Medicare went up and you probably got that letter, Dad, and didn't look at it like I'm telling you to. So in his situation, him and my mom, they're going to have a higher Medicare charge all year because they sold that land. But next year, he didn't sell anything in 2025. It's going back down because they don't have the additional income. Some people just have a significantly higher income where they're regularly paying this every year. So there's a few different scenarios. Like I said, look through that letter. If you have the life-changing event, get us that form in and we'll go from there. And there's more life-changing events. That's just one of the more common ones that we run into when someone's, at retirement age, of course.
Megan, that is a great slide that you just showed right there. And even the example that you just gave is exactly why often with clients, Nate and I will slow down to talk about these things.
Yeah.
Someone, should probably still maybe sell, the family farm, but they should at least have an expectation of how that's going to affect their Social Security payment, right?
Yeah, absolutely.
No one likes, unexpected things like this. So if you can talk about it with someone and plan ahead, that is going to be the best way to go.
Yep, absolutely. So we do have one new application that's available online. We didn't talk about it in survivors, but we have something called a lump sum death payment. This is due to a current spouse that was married to someone when they were passed away, or a minor child or disabled child on the record. It is $255. It's been $255. I'm guessing for its entire occurrence, but definitely for the entire 21 years I've been working here. But that is something available, and it's available online now, as well as, of course, filing for retirement, spouses, disability, and Medicare only. You can do all those things online. If you can file online, that is the absolute best way to go. You're going to get confirmation. You're going to be able to track your application. And I'm going to show you where you can do that in a moment. But you're going to have ability to see that it's being in the works. Of course, we know there's certain situations where people can't file online or use online services. Also, at this time, survivors applications are not available online. So those are situations where you're going to have to call and set up an appointment. The majority of our appointments are done over the phone. One of the reasons that appointments are being done over the phone is that we're starting a lot of work sharing so that we can try to make it a little more equal as to who has availability to appointments. So you're going to call and set up an appointment. It might be someone from your local office calling you. It might be somebody from another office calling you. And that might be because your local office, and this is a common scenario, does not have any appointments available for more than 2 months. So when you call, if there's no appointments available, still call, still get yourself protected because that sets you in the computer and gets you protected with the month you requested for your benefits. But it might be a bit till you get an appointment. So that's where that anyone that can do it online really benefits too. But increasingly, we're working on work sharing. So whenever we can get you an appointment, like I said, it might be with another office. If somebody is absolutely not able to do their business over the phone, we still can schedule an in-office appointment, for certain scenarios where that's absolutely needed. But in that situation, you would be working with your local office and having to absolutely wait for that available date and time with them. So anytime you can use the internet is best. Second best is the phone service.
Yeah. And Megan, just to echo that, yeah, I've done it, help clients online claim their retirement benefits, and it's 10 to 15 minutes. It's super slick. Clients feel good about seeing the confirmation number. We save that to their file, and they feel confident knowing, because I think it says when you can expect to receive it, or when do you want your benefits to start, right?
Yep.
You can
Yep.
select a specific month you want it to start.
Correct.
Can you also put voluntary tax withholding online when you claim? I forget.
So you can do it in the remarks of your application, but it is also a feature of the My Social Security account after the fact now too.
Got it.
So for the input to work after the fact, your case would need to be set up. But what you can do too is, like I said, just put that in the remarks, what percentage you want.
Okay.
If for some reason it's not processed, as soon as your case is set up, you can do the input through your online account as well. You can stop, start, or change it anytime through that
Okay.
online account now.
Great. Thank you.
Mhm. Now, in addition to filing for benefits, most offices have switched to appointment-focused service for pretty much all business involving going into the office. So where you used to maybe walk in to get a proof of income, that's an appointment now. So anytime you want to walk into your local office, first call, set up an appointment. Some offices will take walk-ins, some it'll depend on the day, the staffing, and the traffic. So it's always best for your benefit to call and set up an appointment. If you need a new Social Security card and it can't be done online, a lot of times it can be, there's an online application that anyone can use, including for children, that will allow you to schedule an appointment online after you complete the application. And we're working to get even more appointment services where you can schedule them online. It's in the works of a continuing process of improvement so that you can skip the 800 number to schedule them. But it takes a while for each new thing to get established on that. If you do need to visit your local office or maybe fax something over to your local office, drop something off in the Dropbox, you can use our field office locator. You put your zip code in, it's going to give you the address. You can click in, get the address, the fax number, helpful tools of like, oh, we're located in a corner of a lot, something like that. If they have somewhere that's a little hard to find, they try to put descriptors. Can also have a list of other local agencies that might be helpful based on where you live. So that's a good tool to check out as well. If you do visit the office, we have mobile check-in. So a lot of times here at 9 a.m., I'll see that we already have several people out in the parking lot that have checked in right from their phone before we even unlock the doors. If you're not able to check in on your phone, you can use our kiosk to check in. And we're really emphasizing our Go Digital campaign. So again, emphasizing going to ssa.gov, we're going to talk about creating your online My Social Security account. So if you are over the age of 18, you want to have a My Social Security account created. You can go to ssa.gov, clicking it from the main page. This is the page you should see when you're pulling up our homepage. So just make sure you're looking and seeing this before you click around too much, that you're at the ssa.gov. Our My Social Security account, now we have a video on how to choose to log in or sign in for the first time. If you already have login.gov or id.me, you can use those to link your My Social Security account. I will just say, anecdotally, people, when they do create an account through us, you're going to hit create account a few times. It'll take you through login.gov. If you have any issues with login.gov, just switch over and try id.me. Some of the advocates that we talk to have better luck with id.me. So don't get discouraged if you have any issues with login.gov. Just try the other source. Either one will get you to where you need to be. So again, you're going to go to sign in or create an account. If you already have one of those, you're going to sign in. You're going to have your username and password will be the same as it is for login.gov or id.me. And then you're going to get activation code or security code that you're going to put in to link your accounts. So again, if you have any issues, try the other one. There's the YouTube videos that are helpful too if you have any issues with sign in. Why should you have one of these accounts when you're 18 or older? Well, one of the big things in the very beginning, I said when I was 26, I got one of those statements. We used to send them out by paper to everyone over the age of 25. And of course, that is a ginormous expense, a lot of printing, a lot of mailing. So we have switched to those being online. You will not get a Social Security statement unless you do not have an online account and you are age 60 or older. Let me tell you, you do not want to find out you are missing earnings from years ago when you were 60 years old. You want to log in and check your earnings record once a year. A couple of years ago, I was at an event and this gentleman was missing 1992 and 1994. Well, it was going to be almost impossible for him to get proof of the earnings at that point. And unfortunately, that was back in the years where we sent the paper statements out every year. But he did what a lot of people did, and he threw them in the circular file without looking at it. So he was unaware we were missing those. So just log in once a year, check your earnings, say, great, that 2025 might not be posted yet, but make sure everything up through 2024 is now posted. Then also you're going to see your earnings estimate. So if you have that retirement estimate, that means you have your 40 credits. If you don't have 40 yet, it'll give you that amount that you have. And make sure everything looks correct. You can also look at what your spouse, your children, your survivors would be due if you should pass away. If you need a new Social Security card and you have a valid driver's license or state ID, you can replace that generally right online, skip even going to the office at all. In Wisconsin, you can also do your name change if you've been married generally right online now. That's a newer feature. We do not have it in Illinois yet, but you do have it in Wisconsin. Once you're on benefits, a ton more you can do. These are just some of the things. You can submit wages if you're on disability. You can check your earnings record, still get your proof of benefits. So a lot of people come in, they say they need an award letter or proof of income. We call that a benefit verification. Places like energy assistance, loans for banks, places like that want to see that proof. You can print that right from your online account. You can change your address, direct deposit, phone number right online, unless you are receiving from the needs-based program, supplemental security income, that you cannot do online. Changing your direct deposit online is the only way you can do it now without a visit to a local Social Security office. We no longer change direct deposit over the phone. So that's another really good reason to make sure that you have the online account. We have something called advanced designation where you can set, should you become incapable, who you would want to handle your benefits as representative payee. You can start or change that, get a new Medicare card, 1099s for tax season. You can actually get up to 6 years prior now of your tax forms. So all great tools to have and many more. That's what the Social Security statement looks like. So we'll have your years broken down by every year in the computer, but you can also get this PDF and you can print it. You can save it if you're on your home computer. You can keep it. So sometimes financial planners like you to bring it to their appointments, things like that. So make sure that you have access to that. And it's a great planning tool as well.
Megan,
We
I guess,
just had, oh, go ahead.
sorry, can you go back to that
Sure.
statement? This is great. Yeah, absolutely. Eric and I would love to see these for our clients. One of the key things we like to tell people for, folks that younger like us on the call, presenting here is when it says where they get those dollar amounts, the key thing is in that first blur where it says retirement benefits, the second paragraph, it says assuming you continue to earn about 52,000 a year up until you start your benefits. So that's a key. And people are like, wow, it's going to be a huge number. It's like, yeah, assuming you work up until that age and continue
Yes.
making the income that you're
Yep.
making now,
Yes.
right? Assuming you
Right.
don't have the 35 highest years already in there too.
Sure. And
That's
then we
key.
do have in the online account, there's a retirement calculator where if you're not going to be doing that, you can play around with it and create some different scenarios as well.
Hmm.
Like I'm going to stop work at this age, or I'm going to get a new job and make more money and kind of see how that's going to affect it. But yeah, this statement is operating under that assumption. That's a very good point.
Yep. And the
I'm
online
not
portal
going
has been
to,
great to do
yeah.
those custom. We've had clients do those estimates because like, hey, what if I drop down for 30 grand and for 5 years they can go in there and feel good that they're still going to get the bulk of what that statement shows. So it's a very helpful tool.
Yep.
Sure. And I want to get to questions, so I'm not going to focus on the scams, but just always be aware that Social Security is never going to threaten you, suspend a Social Security number, or demand immediate payment. So whether it's text, email, phone scam, somebody even texting you a badge, just ignore it. If you ever have questions, just call Social Security directly. Or if you get an email and you're not sure it's really to your online account, don't click in the email, just go to ssa.gov and log in that way.
Mhm.
And we are on social media if you want to keep up with us there. And this is up to date as of March 10th at 4:52. If you're watching this recording at a future date, always go to ssa.gov for the most up-to-date information.
Perfect. All right. Thanks, Megan. A lot of great information covered. So yeah, we do have time for Q&A. Like I said at the beginning, at the bottom, there is a box Q&A to type in your question. Otherwise, I believe you can click the raise hand button at the bottom if you'd like to ask a live question, and then I should be able to go in and unmute you and allow you to talk through your microphone if you have a live question. While those are getting queued up, potentially, Megan, one question I have is then, can you just explain like retroactive claims if you're past full retirement age that may stump a few people if they go to claim their benefits or call
Oh,
in and,
sure.
explain what they need to be aware of with that decision?
Yeah, so if you're filing past your full retirement age, you can go up to 6 months back or to your full retirement age. So if you're 3 months past your full retirement age, it'll offer you to go back to the month you turn your full retirement age. Or if you're a year past, it'll go up to 6 months back. You don't have to choose that option. If you want to take it, in the month you're filing, just go ahead and select that box. But it's going to offer you the 6 months back. And just to be aware, this is just a little mention. If you have a health savings account, no matter what, if you're past 65, your Medicare Part A will go back 6 months. And that is something we can't control, no matter when you're
Mm.
selecting your benefit. So just be aware of that because there is interference with health savings accounts when you have Medicare. So that's just a little blurb I thought of as we're discussing this. But as far as retroactive with your checks, they'll offer it to you, but you don't have to take it. It's completely up to you. If you do, you'll get that up to 6 month chunk right when you get started.
Yeah. Plus, but then your future payments would be discounted to your full retirement amount, not for the 667 and 6 months
Correct. You wouldn't
amount.
get the
Yeah.
delayed retirement credits.
Right. Thank you.
Yep.
Yep. Yep. So generally, yeah, we would say don't take that, I guess would be a rule of thumb from Eric and I's perspective.
Right.
So, oh, like we do have a question. Oh, yes, that's great. The question is on the change in the GPO and the windfall elimination provision. Megan says my husband receives a pension, but I now understand he can also receive half of my Social Security benefits. So maybe touch on that,
Yeah.
please.
Yeah, absolutely. A little.
which was a great change. A lot of our clients were happy with in Illinois with the teachers.
Yeah.
Yeah. So this was called the Social Security Fairness Act. I'm going to see if I can get the link up to put it in the chat. Basically, January of 2025, this changed. So there's no longer um, the windfall elimination provision for somebody off their own record or government pension offset. If somebody was already receiving a benefit and it was being affected by this, all those cases have been corrected. But if you haven't filed yet, this will no longer be impacting. So there's a really great site that I'm going to pop in the chat that has all the Q&A, but it will no longer impact or reduce the spouse benefit by the non-covered pension. So yes, they could get up to half depending on their age um, of the benefit. So let me get over the chat here. Is there a way to post a link in for everyone or no?
Um,
I'll put it in the chat for you guys and you can attach it with,
sure. We can
anything you
send it
send
out. Thank
out.
you.
Yeah.
Yeah.
Mm-hmm.
Perfect.
So that'll be coming
Um,
as a tool, but yep.
yeah. And so Megan, just to reiterate that WEP, like if your own benefit was reduced, that's
Mhm.
automatically been or has been fixed by the
Correct.
administration. But if you have not claimed a survivor benefit, or excuse me, spousal benefit, that spouse who did not have enough credits on their own does need to contact the administration, correct?
Yeah,
Potentially?
if they weren't on, like we did have a lot of spouses that were on for Medicare purposes or that were put on in what we call government pension offset. So
Hmm.
those records have also been adjusted. So the only people that wouldn't have it are people that had not been placed on a record at all.
Sure. And so that one, they want to be like deemed filing, right? They would have to claim a spousal benefit, right?
Correct.
Or apply for one, I guess.
Apply for one. Yep.
Yep. Got it. Thank you. All right, another question. I'm currently receiving survivor benefits and allowing my own Social Security to grow to age 70, but now I no longer receive my own SSN statement annually, nor can I see my earnings estimates online. Oh, are you aware of any plans to make this information available so I don't have to call the administration to obtain the
Yeah.
information? Good
Unfortunately, that's a
question.
systems limitation. When somebody is receiving a benefit, it excludes those figures from going online. It could be in one of the of the improvements they're working on. I have not heard anything specific about it, but I will definitely, run it up the chain of command that that's one of the systems limitations we'd like to see go. It takes a while for each of these progression, but I'm confident that eventually they'll get that gone too. But it just takes a while to work around and especially with all the staffing changes we had over the last year, our IT is a little slimmer than it used to be, so it takes a little longer getting the systems enhancements going. But I'll definitely, that's a good one to work on, and I'll definitely note it in our next regional call.
Sure. Thank you. Good question.
Yeah.
All right. I guess, Eric, any questions from you that we haven't discussed?
I don't know. I think the one thing that I just want to really reiterate is the time that it takes to kind of set some of these things up when it comes to like making a phone call. If you want to go into an office to see somebody or you want to set up a specific appointment, to take the time to do that beforehand, to not sort of be in a rush and having to do some of these things last minute if you're not comfortable doing things online. I think it's just important to plan ahead for stuff like this.
Yeah, and I will say our general rule with the 800 number, because it can be a little hard to get through sometimes, it's first thing in the morning or
Mhm.
later in the week, later in the month, and avoid any check dates. So
Mm,
second, third, fourth Wednesdays of the month, and the first and the third of the month are always going to be higher traffic to the 800 number. So
Sure.
those are just some tips when you're contacting to know. If you call first thing in the morning, even if you can't get through, they'll offer you a call back. Whereas if you call later, that won't be an option anymore.
mm, that's
Yeah.
good to know. Well, very good. We're right up on time, so great job, Megan, with the length. Like I said, this is recorded and will be posted to the website in the coming weeks. I guess, Megan, any other final thoughts to leave our viewers with?
I think you guys had some good questions, and Nate and Eric, you had some good questions. So I think we covered it pretty well. Just to get that online account set up if you have
Yep.
not done so already. That's
Right.
the big one.
I agree. It's great, and we can help you once you're in there. Once you're in there, we can help you claim your benefits, pull down the statements, get all the information we need as your planner. So I would echo that. That would be the step one, book one, step one to get that started. So,
Mhm.
well, all right. Well, like I said, we'll wrap it up for tonight. Thanks everyone for listening, and check our website for future webinars. So everyone
All right.
take care and have
Thanks
a
so
good night.
much.
Thanks, Megan.
Welcome. Bye-bye.
Bye bye.